When assisting a resident with oral hygiene who is unconscious, what is the safest method? A. Place the resident on their back and brush gently. B. Use a soft bristled toothbrush and perform mouth care while turning their head to the side. C. Offer water and let them rinse on their own. D. Use a hard bristled toothbrush for better cleaning. Answer: B. Unconscious residents are at risk for aspiration. Turning the head to the side and using a soft toothbrush ensures safety and proper oral care. While helping a resident dress, they insist on wearing clothes that are inappropriate for the weather. What should you do? A. Insist on your choice of clothing. B. Respect their preference and provide guidance if necessary. C. Leave them undressed until they agree. D. Take the clothing away without explanation. Answer: B. CNA must respect residents' autonomy and preferences while gently guiding them to safe choices, promoting dignity and comfort. A resident needs a bed bath. Which of the following is the correct order to maintain hygiene? A. Face, arms, chest, abdomen, legs, back, perineal area. B. Perineal area first, then face, arms, and legs. C. Arms, legs, back, chest, perineal area. D. Face last, then arms, legs, chest, back. Answer: A. The cleanest areas should be washed first to prevent spreading bacteria to more sensitive areas, with the perineal area last. While assisting a resident to use a bedside commode, they begin to fall. What is your first action? A. Call for another staff member immediately. B. Support the resident to prevent a fall. C. Let them fall and document the incident. D. Ask them to grab the bed rail. Answer: B. Safety is the priority, supporting the resident prevents injury, and assistance can be sought immediately after. A resident has a cast on their arm. Which activity requires special care? A. Brushing their hair. B. Washing their hands. C. Dressing the arm with the cast. D. Eating independently. Answer: C. Dressing around a cast requires careful maneuvering to avoid causing pain, skin injury, or cast damage. Which action is correct when shaving a male resident with sensitive skin? A. Shave against the direction of hair growth. B. Apply shaving cream liberally and shave with gentle strokes in the direction of hair growth. C. Use a dull razor to avoid cuts. D. Shave without any cream to save time. Answer: B. Shaving with the hair growth direction and gentle strokes reduces irritation and risk of cuts, especially for sensitive skin. While assisting with nail care, the CNA notices redness and swelling around the cuticle. What should they do? A. Push the cuticle back gently. B. Ignore it and continue with nail care. C. Report it to the nurse immediately. D. Cut the area to remove infection. Answer: C. Redness and swelling may indicate infection. CNAs must report changes promptly to prevent complications. A resident refuses to wash today due to fatigue. How should the CNA respond? A. Force them to bathe. B. Respect their choice and offer alternatives, like a partial wash or bed wipes. C. Skip hygiene care completely. D. Tell them hygiene is mandatory. Answer: B. Residents' autonomy is respected. Partial or adapted hygiene ensures cleanliness while maintaining comfort. Which technique is safest when transferring a resident from bed to wheelchair? A. Lift the resident without a gait belt. B. Use a mechanical lift if needed and apply a gait belt if walking. C. Push the resident quickly to save time. D. Let the resident pull themselves entirely. Answer: B. Safety is crucial. Mechanical lifts or gait belts reduce the risk of falls and injury for both resident and CNA. When assisting with a resident's foot care, you notice a fungal rash between the toes. What is your responsibility? A. Wash thoroughly and apply over-the-counter cream. B. Ignore it, it is not your duty. C. Clean the foot and report the finding to the nurse. D. Cut the affected skin to remove infection. Answer: C. Observing and reporting skin changes is essential. CNAs do not diagnose or treat medical conditions themselves. A resident needs repositioning in bed. How often should you reposition them to prevent pressure injuries? A. Every 4 hours. B. Every 2 hours. C. Once per shift. D. Only when they request. Answer: B. Regular repositioning every 2 hours reduces pressure on bony areas and prevents skin breakdown. C. During perineal care for a female resident, which method is correct? A. Wipe from back to front. B. Wipe from front to back. C. Wipe in any order. D. Only use water without soap. Answer: B. Wiping front to back prevents transferring bacteria from the rectal area to the urethra, reducing infection risk. A resident with limited mobility complains of dry skin. What is the best CNA action? A. Apply moisturizer after checking for allergies. B. Ignore it, it is normal for elderly residents. C. Use alcohol-based lotions for faster absorption. D. Massage aggressively to improve circulation. Answer: A. Moisturizing keeps skin hydrated and healthy, preventing cracks and infection, while avoiding potential allergens. When feeding a resident with dysphagia, which precaution is critical? A. Encourage fast eating to finish quickly. B. Feed small bites, sit upright, and monitor swallowing. C. Allow them to recline while eating. D. Only give liquids to prevent choking. Answer: B. Upright position, small bites, and monitoring reduce the risk of aspiration and choking. Which is the correct technique when assisting a resident to brush their teeth with dentures? A. Brush directly in the resident's mouth without removing dentures. B. Remove dentures, brush gently, and store them safely when not in use. C. Soak dentures in hot water only. D. Skip brushing if the resident has dentures. Answer: B. Proper denture care prevents infection, maintains oral hygiene, and protects dentures from damage. A resident refuses to wear a hearing aid. How should the CNA respond? A. Force the resident to wear it. B. Remove it permanently. C. Respect the resident's choice and document refusal. D. Hide it to encourage compliance. Answer: C. Respecting residents' autonomy and documenting refusals is part of ethical CNA practice. While helping a resident bathe, you notice bruises on their arm. What is your responsibility? A. Ignore them if the resident does not mention it. B. Report findings immediately to the nurse. C. Ask the resident to explain without reporting. D. Document but take no further action. Answer: B. CNAs must report suspected abuse or unexplained injuries to ensure resident safety and proper investigation. How should a CNA handle a resident's belongings during personal care? A. Place them in a secure, designated location and respect privacy. B. Throw them aside to make space. C. Leave them on the floor temporarily. D. Let the resident hold everything themselves. Answer: A. Maintaining dignity, privacy, and security of personal belongings is part of respectful care. When assisting a resident with toileting, the CNA notices blood in the urine. What is the correct action? A. Document and report immediately. B. Assume it is normal and continue. C. Advise the resident to ignore it. D. Flush the urine and continue routine. Answer: A. Blood in urine may indicate a serious medical issue. Prompt reporting ensures timely care. A resident with Parkinson's disease struggles with feeding themselves. What should the CNA do? A. Feed them slowly with encouragement and adaptive utensils if necessary. B. Let them struggle without assistance. C. Feed rapidly to finish meal. D. Avoid giving them food until able to self-feed. Answer: A. Adapted feeding and patience allow independence while ensuring nutrition and safety. While giving a back rub, the CNA notices skin breakdown. What is the next step? A. Rub harder to stimulate circulation. B. Document and report to the nurse immediately. C. Ignore minor redness. D. Apply lotion and continue routine. Answer, B. Skin breakdown can worsen quickly. Prompt reporting ensures treatment and prevents infection. Which technique is safest when trimming a resident's toenails? A. Cut nails straight across and avoid cutting into the corners. B. Cut in a curved shape. C. Cut deeply to prevent ingrown nails. D. Use the same clippers for multiple residents. Answer, A. Straight cuts prevent ingrown nails and infection. CNAs must use proper tools and hygiene. When assisting a resident with hair care, which action maintains safety? A. Pull hair firmly to remove tangles. B. Use gentle brushing, dead angle carefully, and respect personal preferences. C. Use chemical relaxers without permission. D. Skip hair care to save time. Answer, B. Gentle techniques protect scalp and hair, and respecting preferences promotes dignity. A resident with dementia refuses bathing. What is an effective approach? A. Force them into the shower. B. Offer a sponge bath, explain calmly, and give choices. C. Skip bathing for several days. D. Call security to assist. Answer, B. Calm communication, choices, and alternative bathing methods reduce agitation and maintain hygiene. Which is the best method to prevent cross-contamination during personal care? A. Use the same gloves for multiple residents. B. Wash hands before and after care, and change gloves when needed. C. Wipe with a shared towel. D. Skip hand washing if wearing gloves. Answer, B. Hand hygiene and glove changes prevent the spread of infection and protect both resident and CNA.